Assalamu alaikum wa rahmatullahi wa barakatuhu, esteemed viewer wherever you are. May peace and the blessings of Allah subhanahu wa ta'ala the Almighty be with you all. Once again, I'm back. We are back with your program, Healthy Check, a program where we discuss strictly health issues, a program where you get medical advice from experts. And in today's episode, I'm still with our brother, Chibugo Hamidu, a dentist. Do you mind saying salam to our viewers?
Walaikum salam wa rahmatullahi wa barakatuh.
That is Brother Chibugo Hamidu there for you. And later on, we'll be joined in by our external expert, a special worker, Brother Mr. Okrut. Inshallah, he'll be joining us. He's on the line and he's following. Today's program, my brother, we're going to discuss about dental emergencies. I would like you to help our viewer. What are these dental emergencies? What are they? And later on, we'll see what causes them and what are the preventions. But let's get to know what the dental emergencies are in the first place.
Thank you so much. Our dear viewers, assalamu alaikum wa rahmatullahi wa barakatuh. An emergency is something that catches you unaware. Just when you think, and that thing cannot wait. Okay, so when
you can't hold it.
So when you talk of dental emergencies, these are issues that happens around our mouth. Okay, that we have to handle with immediate effect.
Okay,
and if at all we don't, our health will not remain the same. They might worsen and we get more complications. So these are things we are going to discuss, that when it happens, it really needs special attention. Yes. So very many people think you can only visit a dentist at will. So what are some of these things? That when you get it, it's advised that immediately you seek dental help. These are what we are going to discuss.
Okay, doctor, let me hold you a bit there before you go any further. Let me ask my brother Okrut to come in. Since he interacts more with these patients, he sees more of them day by day. That's the task that he went for in school. So I'm going to ask brother Okrut out there, please just let us go through, or let us know the types of emergencies that you go through day by day, inshallah. Brother Okrut.
I want to take this chance to thank the people behind all this, especially the moderator of the program, for giving us this chance. Dental emergencies, briefly, these are issues or like conditions of dental origin which involve the tooth or it is supporting tissues that need to be worked upon by a professional. So when you go straight to the causes, there are different causes of dental emergencies. One of it mostly is toothache. That these types of toothache, which I've taken like 1 or 2 days when someone has been seriously having toothache that they cannot do anything else. So that one, it is a dental emergency. And then two, there is what you call bleeding of an extraction wound. Like after someone has gone for an extraction, there is that bleeding and then the pain someone gets after the extraction. That one is also a dental emergency. That should not be taken as a slight issue. And then the other cause of dental emergency, when someone has a cracked tooth, most especially maybe when someone is involved in an accident or someone has been knocked, such therefore traumatized. Most times people get cracked teeth. So that one also is not something which is light. It's considered to be a dental emergency. And then the other is, there are some other people who have gotten artificial teeth. So when there are some instances whereby those teeth come out, that one also is a dental emergency, meaning you have to go and see a dentist or a dental professional to make sure that that thing is fixed very well. And then there is also a swelling, or what we always call an abscess. Whenever someone has gotten an abscess, that's not a slight issue. because having an abscess, it means there is too much accumulation of microorganisms in that area. It can be of a tooth origin or not of a tooth origin. So some other abscesses, like you can have a swelling, so you may not differentiate between an abscess and a tumor. So having a small swelling, which you may think is an abscess, is a very important condition that you should go and see a dentist as fast as possible. And then also development of wisdom teeth. Wisdom teeth are these last teeth, last molars. They're always they're always the third ones from each jaw. Those are called wisdom teeth. Some of them, like when they're developing, they tend not to develop in the right manner. That can be due to the space left for them to develop might be small, or some other conditions that can make them not to grow very well. So when they're developing and you're having some slight pain or slight discomfort, that one is also considered to be a dental emergency, that you can go and see a dentist as fast as possible. That's the brief thing I can tell about dental emergencies. So in case of anything, please always having a dentist you trust, or like having a person you know can help you about any dental issue is always very important. I remain Martin Okrut. Thank you for that precious moment you've gone down to me for sharing these small views and the people.
Thanks a lot, Brother Martin Okrut. That is our brother, an expert in the public health service, sector. That is through experience. That is what he receives day by day. And I'm now turning to the one that is an expert in dealing with such emergencies. Brother Chibugo Hamidu, a dentist. I'm now turning to you.
Yeah.
Many he has mentioned: toothaches, bleeding, cracked tooth, artificial tooths that are at the reach a point of coming out, swelling, and then the wisdom teeth. So I'm going to ask you, how do you deal with such emergencies? And later on, you'll help us, help our viewer to there. How can he prevent such?
Thank you so much, and thank you, our brother Okrut has brought it well. He has named several
of them,
though they are still there, and we shall go through them.
Okay.
But to start with what he has discussed, toothache is the most common emergency.
Exactly.
So if at all you feel any toothache, you don't know what's the cause. Okay. So you should come to the to health facilities to first of all know what is the cause of this toothache. Okay, it can be a wisdom tooth growing, as he has said. It can be a hole in the tooth. So when we talk of toothache, first of all we have to know where the pain is coming from. It can be a sinus infection. It can be a cracked tooth, as he has said. It can be a wisdom tooth growing. It can be a hole in the tooth. Now, at each stage, we manage differently. Now, if at all it is a cavity forming that is so deep to the pulp and is causing the pain, there we have to extirpate, or we have to remove the sensitive part of the tooth, which is the pulp, a treatment called root canal treatment, aiming at drying up this tooth, leave it functional but non-sensitive. So when we go in our communities, very many people think the only solution to a toothache is removing
it.
So we don't agree with them that one, over these reasons, that one, not that every toothache you get, it necessitates removing a tooth. We have some causes that are non-decay related.
Actually, I personally, I've faced several toothaches. I've experienced several of them, but with removing a tooth at this age of mine, by the age of 40, I think I'll be having none. Yeah. I'll be having not any.
Those ones who say that, they don't know the nature of a tooth. A tooth, its cells stop even before birth. a tooth cells deposit, that when a child is born, they have 2 sets of teeth already there, waiting for their time to come so that they can erupt into their oral cavity.
What are those shapes?
So a tooth doesn't grow, the primary and the permanent dentations.
Okay.
You have 2, the primary and permanent. So maybe developing, the root developing is the one that is remaining, but the crown is already there. When you take an X-ray, you'll find those 2 sets already there in a child. Now, that's why the size of a tooth that grows is the one that remains. If at all you have small teeth, you'll have small teeth throughout your life. If at all you have large teeth, you'll have large teeth throughout your life. So a tooth doesn't grow. So that's why, as an option of tooth removal, there is root canal treatment. If at all the roots are so much, they are not much curved, the crown is not so much broken down, we can remove the pulp, then we replace the pulp where the pulp was with a filling material, a root filling material. We keep that space tight. Now, if at all the hole is in the pulp, that is the only optional treatment. If at all we just cement, there are some people or some patients who come and wants to dictate what they want to be done. After all, it's my money, so do what I have to. I'm telling you. So if at all you happen to cement a tooth that required a root canal, these are people who will keep on saying that cements are painful. I cemented a tooth, but it's still paining. So that means that the tooth was given a wrong treatment. So that is toothache. So whenever you get a toothache, it's an emergency. It's something that doesn't need to wait. Go to any facility. First of all, they diagnose or they get to know what's the cause of the toothache. Then you have a right treatment given. Now, in those, another emergency that can come in, he even talked about it, is that when a tooth doesn't receive timely treatment, the pulp will start dying off. When it dies off, you might wake up one morning having the cheek distended or swollen.
Okay, doctor, please, let's now go to the second emergency.
Yeah, the second emergency is abscesses or swollen. Mr. Okro termed this as a swollen cheek or gum. Now, he also rightly put it that it is microorganisms that accumulate in that area. Okay. Now, when you have a very deep hole that has reached the pulp starts to die off. Now, when it reaches the apex at the tip of the rod, that means microorganisms will spread around the rod, so causing pus to accumulate around that area. So very many people come with swollen cheeks, but they don't know that actually that is pus. When you tell it to them, they seem to be more surprised. So whenever you have a swollen cheek, that is pus collecting in the inside your bone. Okay. So if at all you get it, that's an emergency. You have to rush very fast
as soon as you can
to the facility. Now we have, by the way, dental problems. They really, someone can't die because the tooth is paining, but the after effects of maybe toothache can cause someone to die. How does it happen? I can explain it alongside this second emergency, which is swelling or abscesses. That wherever it is, if at all you don't treat that abscess, there are some partial spaces in between cells. There are spaces. When you have one cell and another, there is that imaginary space that is in between them. Now, when there is an infection that has set in between those cells, it is hard to be fought. If at all it forms, it can easily spread to the heart, or it can spread to the cavernous sinuses that cover the brain. Okay. And that's when someone can die of a toothache. But it comes out of utter negligence.
So that's how risky it is to sit down and relax when you...
So when you have a swollen cheek, please rush to the dental facility and you have it drained or the tooth removed. Very many people, some people have a thinking that when you have a swelling, you don't, when you have an abscess, you don't have to extract a tooth.
Oh.
It's just there.
Is it sometimes necessary to remove a tooth?
Once you get numb, if at all a dentist can numb you and the pain goes, let this tooth be removed. When it's removed, we can easily drain out that pus. If at all you don't drain it out, then make an incision and you drain out the pus.
Okay.
So long as pus is still there, even these normal antibiotics can't penetrate into the pus because pus walls off itself wherever it is. Okay. So when you have an abscess, drain it or remove the tooth. Or a root canal can still be done on that tooth.
Now swelling is done, doctor. Let's now take a look at the third
emergency. We can talk of chipped, cracked, and cracked tooth.
Okay,
now, some people don't want to make a simple expense of buying an opener. They use their teeth to handle some tasks.
Bottles of soda.
Others, when untightening a screw, they want a nut. They want to use their teeth. Those are bad habits. You shouldn't use them, because if at all you have that tooth cracked, it will cost you a lot of money to replace it than the amount of buying
a pliers or an
opener. So we should desist from it. But if at all you happen to crack a tooth or you have a chipped one, please rush to the dentist. At least it can be fixed. Either a crown is fabricated or a tooth can be cemented. Another emergency that we can talk of is a loosened or a knocked out tooth. In the sports you can fall. Someone can just, in fights, someone can punch you and the tooth falls out. By the way, the nature of trauma on teeth, when you find out a knocked out tooth, it will come completely. You will not find any damage on it. Or, if at all it's an impact, a tooth faces an impact, it can crack either where you see on the crown or at the root. So in all trauma cases, it's advisable to take an X-ray. When you take an X-ray, you can easily see where the crack is. If at all it doesn't have a crack and it's just loosened, what we do, we splint it, as in we can use a wire, use the neighboring teeth to fix it, to have it firm in one place.
Okay.
Then healing can happen. Now, when a tooth completely falls out, please don't lose hope. You should just act fast. This is an emergency.
Do I need to pick up my tooth?
You have to pick it up, but by the crown, that white part of it. Don't touch the root. Okay? Because those cells are not yet dead. Okay?
I don't need to touch that white.
You don't need to touch the root, the part that you don't see.
Okay.
Yes.
The lower part of the tooth, I don't need to touch it.
So when the tooth has fallen out, just pick it by the crown.
By its top?
Yes, that white part. Then you can wash it, but just run water over it. Don't touch it. Okay?
You don't need to get a detergent, a brush to clean it.
If you can, refix it immediately.
Oh, how is that possible?
If you can't do it, you can keep it in milk or water, then rush to the dentist. When you reach there, the dentist will just reimplant it there. If at all you have pain, they will numb you, then push it back where it's supposed to be, because the socket is still open. So they will just push it back, then we splint it. After 3 to 6 weeks, the tooth will be firm again. What will be done is we shall remove the nerve, we shall do a root canal. Because if we don't, the blood that clots inside the tooth will make it start to change color. By the way, if at all you have any impact, it's better you go to the dentist. The dentist will assess and see how much does this tooth move. If at all it moves so much that the blood supply is cut off, blood will clot inside the tooth because there is nerves and blood vessels inside there. So when blood clots and it starts to break down, it will start penetrating into the tooth. That's why you can find someone with a black tooth in front, and when you start to ask, they say, one day I was we were playing soccer, someone knocked me. Okay, but I didn't take it serious. So whenever you have a trauma, any trauma on a tooth or any damage, someone has boxed you, if at all a dentist see that the blood supply was cut off, it is good we remove the nerve. The tooth will be non-sensitive, but it won't change color. If at all we don't remove the nerve and it dies from inside there, the tooth will start to change color, and with time you will require a crown to regain your smile back.
Thanks a lot.
Another
doctor, I
emergency
think,
we can talk of he talked of bleeding. So it can be bleeding after tooth extraction. So ideally, when we remove a tooth, we have to pack there a piece of cotton that you have to bite on for 30 minutes. Now, after 30 minutes, we expect a clot to have formed. If you remove the cotton and you still have bleeding, it's better you either contact a nearby dentist or just go back there, because it can be because you didn't follow the post-operative instructions, or it might be a defect in your blood system. So it's better you go back, a dentist handles it. It's an emergency that doesn't need to wait. Another source of bleeding can be gum diseases. It can be gums that are bleeding. You brush, you see bleeding, it's not normal. You go, you have your teeth cleaned. Or it can be a cancer that is causing bleeding, which you can't know except a dentist has done an examination. Another emergency are soft tissue injuries and jaw fractures. The cheeks, tongue, you can bite it, or it can get any wound or injury. So either there might be bleeding that needs to be stopped. But if at all you get any soft tissue injury, and maybe there is bleeding, or you have pain, or it's big that needs suturing, you can go to the dentist immediately and you have it repaired. Even jaw, someone can get involved into an accident and maybe jaw breaks. That's also another emergency.
Okay, Brother Chibugo Hamid, I believe there are so many of them left, but time won't allow us. But for those that you have mentioned, I'm going to request you in just a few minutes to help our viewer out there. How can he prevent? Of course, every disease, I think there is a prevention method. So how can they prevent these emergencies? In just a few minutes.
I was reading somewhere, someone said we have a single mouth. Have you ever thought about it?
A single mouth?
One mouth.
Okay.
We have two eyes, but for the mouth, it is one. So what we have to do is that whenever you are faced with anything strange, try to get as much information on it as much as possible. So the best, if at all you face it, go visit a dental professional. They can help you how to go about by that emergency you've faced. That's the general preventive method. But if at all, for those ones who are doing contact sports, football, rugby, and other kind of sports. At least there are some mouth guards. Those ones who are doing boxing, I think those ones are the most who use those mouth guards. So let's try to do some protection, helmets. So whenever you are doing those contact sports, at least have your oral cavity protected, either with mouth guards, helmets where applicable. They will hope that even if you get an impact, it will stop on this guard. It won't get your tooth. Another thing that I can talk about in the prevention is that we should avoid fixation. Fixation is trying to use, for the case of the mouth, trying to use your teeth to do things that are not supposed to be done. Chewing on anything that is not edible. So if at all, as we've said, buying an opener is very cheap.
Actually, some of my peers are saying that cheap things are always expensive. There are some of our brothers that think buying cheaper beans where you're going to eat more of the stones. As to the rice itself, I think that will cost them a lot. It's better they eat food that is free from such.
But they can even save some time, and they sort out the stones. Yeah, it will save you a lot of money repairing a tooth than the time you can take to sort out those stones. So I was talking of fixation, that we should desist from using
that one
the
be
teeth.
The last. Okay.
We should desist from using the teeth what they are not supposed to do. We should desist from eating things that we are not supposed to do. You find someone eating bones. If at all you start chewing on bones, what will the cats do and dogs?
And the dogs.
Yeah. So if we do that, then timely treatment. All emergencies, what matters in emergencies is timely management. So don't see bleeding and say, maybe it will stop. Just run to the dentist.
Okay, that is it from my brother, a specialist in as far as the dentistry sector is concerned. You've heard each and everything that time would allow us. So please take his advice as serious. Take his advice as something that will save you millions and millions of money. My brothers out there who would like to turn into carnivores, please leave that, the bone thing, the bone issue to the dogs and those animals that fall under that group. So since time is not a best friend with us, I'm going to ask you to allow us to put this program to a stop for this time, but more episodes and more programs are still coming. Just stay tuned in MTA. I remain Bashir Nambale, your host. Until we meet next time, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum salam.